Tracey Technologies is in the City by the Bay for the 2023 annual meeting of the American Academy of Ophthalmology. They've brought along their iTrace, and with its new iTrace Prime software, doctors here in San Francisco are taking notice. Two of them, Doctors Nicole Fram and Eric Donnenfeld, joined us at AAO to talk about the iTrace, how it makes cataract and refractive patients' complex visual functions simple and quantifiable, and what that means for their clinical outcomes.
Hi, I'm Eric Donnenfeld of Ophthalmic Consultants of Long Island. My subspecialty is really refractive cataract surgery.
My name is Nicole Fram. I'm in private practice in Los Angeles, California at Advanced Vision Care. So the iTrace is an instrument that I acquired probably 7 years ago. And I actually cannot imagine practicing without it at this point. I do a lot of complex surgery and I do a lot of refractive cataract surgery. And so what that means is I want to know what's coming from the cornea and what's coming from the internal aberrations of the eye, looking at spherical aberration, looking at the amount of coma, looking at angle kappa, angle alpha. Who's a good candidate for a diffractive IOL? Who's a good candidate for a monofocal IOL? And who would do well in a post-LASIK, light adjustable situation based on that whole analysis?
The number one advantage of the iTrace clearly is that it differentiates between corneal and lenticular problems. All the other technologies that I have right now don't do that. I'm looking at a summation of all the visual problems the patient has, but it doesn't separate the visual problems. The other thing that I like very much is it gives me the high order aberrations. It tells me about high order aberrations on the cornea. That gives me information about what type of IOL I should be implanting. And it allows me to get information about such various technologies as the small aperture aphthera lens. It'll show me how the vision will improve if I move from a 5mm pupil to a 2mm pupil. And it can actually give me a lot of very good information about the visual prognosis patients have when they're undergoing surgery.
I think the most impactful thing that really got me sold on the iTrace was this idea of the canceling effect of high order aberrations and astigmatism. To be able to look at the Chang analysis and see if it's the right timing for their surgery when they have a complex cataract has really helped me be a better doctor to my patients and lead them into better expectations after surgery.
The significant difference that the iTrace makes is it eliminates the questions that I have in the back of my mind of what type of procedure I should be performing. I think as clinicians very commonly will have 2 or 3 different alternative solutions to a problem. This lets me hone down on the one specific recommendation that I can make to a patient that's going to give them the best outcome possible.
I think it puts it in a language and gives them a visual that they can understand. They can see that we're being really thoughtful about the process of what technology. Right now, there's so many lenses. And when you're able to show the patient what's happening to them due to their cataract or due to their corneal high order aberrations, they can understand the limitations of the technology and the benefits of the technology.
Well, the iTrace gives me the digital information that I need for making tough decisions, but it also creates a visual display that's very understandable for the patient. And many times when I show them the visual display, they'll look at me and they go, that's exactly what I'm seeing. And that gives them the security to know that I have an answer to their problem and my surgical solution is going to have a good chance of being successful.
What I would say is that it's one of those technologies that you acquire that you realize, how in the world did I practice without this? Even when we have to shut it down for like a couple days to get an upgrade, I'm like, let's get all the iTraces in before they shut us down for 2 days to get that upgrade. And that's how impactful it is. That's how much we use this technology in our practice.
For surgeons who don't have the iTrace, I would say to them, you don't know what you need until you have it. You think you can function intelligently in your practice without this technology, And then once you have it in your practice, you realize that you've been missing a lot of good information that would have made a difference in your surgical daily practice. And the iTrace gives me information that's not possible anywhere else.
For doctors Donnenfeld and Fram, iTrace gives them the accurate and reliable measurements they need to make a patient's visual function quantifiable. When is it time for your cataract and refractive practice to take the next step with iTrace and Tracey Technologies? Head on over to their website or contact a sales representative today to find out how.